Welcome to Module 13. My name is Desiree Cochran-Norfolk. I am an addiction counselor. In this section of the course, we are transitioning into the first aid and safety portion of the training by discussing universal precautions and bloodborne pathogens. So, as behavioral health professionals and addiction counselors, we may occasionally encounter situations that may involve blood or bodily fluids or injuries, medical emergencies, maybe even an accidental exposure risk. And even though counselors are not typically functioning as medical providers, it's still important to understand basic workplace safety principles and how to respond appropriately in situations where an exposure might occur. So we're going to focus on what bloodborne pathogens are, why universal precautions matter, and how exposure risks happen. What kind of protective equipment and safety practices are there, and how to maintain professionalism during emergencies. One important point to remember here is that universal precautions are designed to protect everyone consistently. And these precautions are not based on assumptions about who looks sick or who may or may not have a medical condition. So professional safety practices should be applied consistently with every person because a lot of infections are not visible, and some people may not even know that they're infected, i.e. COVID. So the goal is not fear or panic. The goal is awareness and consistency and safety. So bloodborne pathogens are infectious microorganisms that can spread through contact with infected blood or certain bodily fluids. So examples of this might be HIV, hepatitis B, or hep C, and these infections are going to cause serious health problems if they're transmitted to another person. So it's really important to understand that bloodborne pathogens are not spread casually through everyday interactions, okay? Transmission typically requires specific types of exposure, like the blood entering another person's bloodstream through needle injuries or open wounds or mucous membranes or other direct exposure situations. In a lot of workplaces, including counseling programs and treatment centers and healthcare settings and community centers and whatever, we all use safety protocols that are designed to reduce exposure risk. So understanding bloodborne pathogens helps us respond calmly and appropriately during situations involving injuries or bodily fluids. And again, the goal is always professionalism and safety, not a fear-based reaction. So the universal precautions are safety practices that are designed to reduce the risk of exposure to the bloodborne pathogens. So the core principle is really simple. Treat all blood and certain bodily fluids as potentially infectious. That doesn't mean assume somebody's dirty or dangerous. Instead, it just means applying consistently the safety practices with everyone, rather than just making assumptions about risk based on appearance or diagnosis or stereotypes. Universal precautions are going to exist because some people may not know that they have an infection, or some conditions just don't have any visible symptoms. And consistent safety practices are more effective than selective caution. So the universal precautions are going to include wearing gloves when exposure to blood is possible, avoid direct contact with the bodily fluids, properly dispose of any contaminated materials, and wash your hands thoroughly after exposure situations. These practices are going to protect both the staff and the clients while maintaining professionalism and dignity. We should avoid reacting with panic or visible fear during situations involving blood or injury. Calm, consistent responses are going to help maintain emotional safety and professionalism, because they're probably going to be freaking out that they're bleeding in the first place. Although the counseling setting is not typically a medical environment, exposure situations still occur. So clients may be experiencing accidental injuries, nosebleeds, fights or altercations, self-harm incidents, overdose emergencies, accidents involving glass or sharp objects. So behavioral health professionals we're going to encounter a lot of different situations where clients are just highly intoxicated or they're emotionally dysregulated. Maybe they're medically unstable. And in emergency situations, adrenaline and panic can sometimes cause people to forget their safety procedures. That's why training and preparation are going to matter. So you need to focus on staying calm, protect yourself appropriately, contact emergency services when it's necessary, and avoid any unnecessary exposure to yourself. You've got to recognize what your personal limitations are and remain within your scope of practice. Don't try to be a hero and stitch them up in the field. We're not expected to perform any advanced medical procedures, but we should understand how to respond safely with, until the medical professionals get there. So wear personal protective equipment, or we call that PPE. That's the equipment that is used to reduce exposure risk. So in a lot of behavioral health settings, gloves are the most commonly used form of PPE. And they have a protective barrier between the counselor and the potentially infectious materials like blood or bodily fluids. So we should know where the gloves are, where are the emergency medical supplies that are located in your workplace. It's also important to use PPE appropriately and consistently rather than selectively. So, for example, wearing gloves with one client but not another based on assumptions about appearance or identity may communicate stigma or discrimination. Like if you're having to do a drug test, wear your gloves. Like there could be urine on the outside of that cup. So wear gloves to handle the cup. And then also proper disposal of contaminated materials is also important. Use gloves or contaminated items. They should be disposed of according to workplace procedures and safety guidelines. Professionalism is going to include responding calmly and respectfully during situations that involve injury or bodily fluids. One of the simplest and most effective infection control practices is just proper hand washing. Wash your hands, before and after exposure situations, after you remove your gloves, after you contact bodily fluids, according to your workplace protocols. Use soap and use water whenever possible and wash thoroughly rather than quickly. You don't want to wash quickly, you want to wash thoroughly. Basic hygiene practices are really important, not only for your physical safety, but also for maintaining professional standards within the treatment environment. Infection control is not about fear of clients. It's about maintaining safe environments consistently for everyone. So simple safety habits become more effective when we practice them routinely rather than only during moments of panic. Possible exposure, if it happens, we need to remain calm and follow our workplace procedures immediately. The panic is going to interfere with you thinking clearly and appropriately responding. So, maybe an exposure situation might be like accidental contact with blood through broken skin, or a needle injury, or a contact involving your eyes or mouth or mucous membranes. A lot of agencies have specific exposure protocols that include like reporting procedures, documenting requirements, medical evaluation recommendations, and then follow-up steps. And so we do not need to ignore any exposure incidents out of embarrassment or fear. Do not ignore them. Prompt reporting is going to help to ensure appropriate medical guidance and your workplace support. The goal is calm professionalism rather than catastrophic thinking. Most casual contact situations don't create significant HIV transmission risk, so understanding actual transmission pathways helps to reduce unnecessary panic. And one challenge in discussing bloodborne pathogens is balancing safety with stigma reduction. Clinicians, we should be taking appropriate precautions without panicking or shaming our clients, or like reacting in a way that's going to increase fear or embarrassment. So, for example, don't dramatically pull away or appear visibly disgusted or make alarmed comments. Oh my God. That can negatively affect the clients emotionally. Remember, universal precautions are designed to be consistent with everyone. So professional safety does not require fear-based behavior. A client that's experiencing medical emergencies or injuries are often already vulnerable or embarrassed or frightened. So calm and respectful responses help maintain dignity, and especially during a very stressful situation. So we have to aim to be professional and emotionally steady and appropriately use our safety practices. And we should always remain aware of what our scope of practice is during an emergency situation. So we could contact emergency services, provide basic first aid within your training, and maintain safety and support the client emotionally until help arrives. Your role does not include performing advanced medical procedures or diagnosing conditions or attempting interventions outside of your training. Sometimes we feel pressure to fix the emergency ourselves, especially when the client is distressed. But professionalism includes recognizing what your limitations are and seeking appropriate medical support when it's needed. Knowing when to call for help is a really important skill. It's not a weakness. So as we close this module, I want you to remember that universal precautions and bloodborne pathogen awareness are about safety and consistency and professionalism. We should apply precautions consistently, remain calm during exposure situations, and protect ourselves appropriately. We also want to maintain respect for our clients' dignity at all times. Understanding transmission, the realities of it, also helps us to reduce the unnecessary fear and stigma in the behavioral health setting. So in the next module, we're going to discuss recognizing medical emergencies and understanding when emergency medical services should be contacted in counseling and community environments. So when you're ready, proceed to module 14.